Vaccinated with Sinovac? If you have, you will still have to undergo pre-event testing. VivoCity's car park transforms into a COVID-19 testing area for retail staff who work at the mall. And after months of delays, 6 more stations on the Thomson-East Coast MRT Line are set to open in August. It's 5:30 p.m. here in Singapore. You're watching The Big Story. I'm Haryanto Diman, coming to you live from the Straits Times newsroom. You can subscribe to the channel so you never miss a single episode. Now, if you have been inoculated with the Sinovac COVID-19 vaccine, you will still be required to undergo pre-event testing. The Health Ministry said today vaccines that are not part of the national vaccination program, like Sinovac, may not be fully effective in protecting against the more transmissible Delta variant. While Sinovac is available here, it is to be provided only under the Special Access Route framework and not covered under the Vaccine Injury Financial Assistance Program. The government previously said that those who are fully vaccinated are exempted from pre-event testing for events like live performances, MICE events and wedding solemnizations. Now, we'll have more on this during our interview with Professor Teo Yik Ying from NUS later. Meanwhile, COVID-19 testing is underway for residents of Block 91 Henderson Road. This comes after MOH detected 5 infections among 3 households there. The mandatory testing for residents will go on at the pavilion at 96B Henderson Road today and tomorrow between 9 a.m. and 4 p.m. Swabbing is, however, optional for residents who tested negative for the infection from June 25th. This exercise follows several rounds of mass testing at various other HDB blocks in the Bukit Merah and Red Hill area, including blocks 103 and 105 Henderson Crescent. Similarly, another swabbing operation is being carried out at the VivoCity car park. This is for all staff who worked at the shopping mall and the nearby Harbourfront Centre's retail mall between June 13th and 28th. VivoCity's management said that cleaners, security officers, contractors and safe distancing ambassadors who worked at the mall during that time frame will also be tested. Shoppers, however, do not have to be tested unless they have been specifically notified by MOH. Several staff whom ST spoke to said the swabbing process was generally smooth.
It's smooth. Of course, it's VivoCity, so there's a long queue, but it's actually quite fast. Yeah, and then it's actually quite good. They guide correctly, and then it's quite it's quite clear on where to go.
Quite smooth. Yeah, it's okay. Nothing normal. Just a queue and quite smooth. Yeah. A lot of queue quite long.
Yeah, it's very fast. Even the queue also very fast. Even the long queue, they make it within 10 to 15 minutes. Really fast.
So are you worried at all?
Not much because I already have 2 doses already. Yeah. My vaccination, 2 doses. Yeah.
We all take the safety measures, right? As long as we do that, I think should be fine.
On to the latest COVID-19 figures. Singapore reported 5 confirmed cases in the community. All were linked to previous cases and were already quarantined. 11 other cases were imported, with 6 detected when they arrived here and 5 developed COVID-19 during SHN or isolation. More details will be released tonight. You may have noticed that from last night, the Health Ministry has changed the way it reports COVID-19 details in its daily updates to the public. Apart from the case numbers, MOH will no longer provide the profile of each new case in the community, like their age and occupation, as well as the places they visited and the dates they tested positive. Instead, the new format focuses on key trends for local and imported cases, the number of active clusters being monitored, severity of the patient's conditions, and progress made in the nationwide vaccination drive. For a closer look, Professor Teo Yik Ying joins me now. He is the Dean of the Swee Hock School of Public Health at the National University of Singapore. Welcome back to the show, Professor. What could be the motivation behind the changes? Is it no longer necessary for the public to know the details of the confirmed cases, for example, like the places they visited?
Thanks for having me. Actually, the change is very much in line with the plan that was announced by the multi-ministry task force, the three ministers, to progressively move towards seeing COVID-19 as an endemic disease, where there will be increasingly less emphasis on the number of daily cases and where people were exposed at. By not releasing the details of the individual cases, we are sending a very clear signal to the public that as we continue to vaccinate more and more of our people, it is increasingly less important to know where and when people were infected, and instead shift our focus to whether these infected people have developed severe symptoms and whether they were hospitalized. So the new format clearly outlines some of this information as well as the status of the vaccination rollout in the country. So the reality is that as more and more people are vaccinated, we may become less focused on whether these people have been infected or not, especially since the vast majority of the infected people, because of the vaccine, are asymptomatic or at most have mild symptoms. And this is exactly the kind of protection that we expect the vaccine to provide, that vaccinated people, when they do become infected, never really develop severe symptoms that require hospital care or leave any long-term impact to their health.
And Professor, by focusing on key trends, clusters and vaccination progress, how useful will this new format be for people in general?
So certainly I believe this information will be a useful update to the population in terms of the number of people that have been vaccinated, the number of people who experience severe symptoms that are hospitalized in high dependency wards or in ICU. Or are they mainly the unvaccinated people? I think this helps to address some of the misinformation that is still circulating in social media, essentially around the value of vaccination. By clearly showing that through data, through the real world data that we see in Singapore, that vaccinated people are much less likely to experience harmful effects when infected, because the vaccine is protecting these people from severe symptoms that require hospital care. This is exactly the kind of information that helps to strengthen the confidence in the vaccine and to encourage those who have yet to be vaccinated to come forward and to take the vaccine. And I see this to be very important as we move towards treating COVID-19 as an endemic disease. Because when the key trends are able to show that infection numbers may continue to increase, but because the vast majority are asymptomatic or have very mild symptoms, and that the vast majority never require any short-term or long-term hospital care, this is exactly the kind of signals that tells us we can now relax many of our restrictions, especially when the uptake of the vaccination continues to increase in the population.
And on that note, Professor, what about on the national level? How will this new focus shape future policy-making decisions relating to COVID-19 matters, for instance, on the air travel bubble arrangements perhaps?
So earlier on, I talked about how we intend to treat COVID-19 as an endemic disease. And this means that COVID-19 is going to stay in Singapore, very much like influenza, very much like dengue, and that we will have a baseline number of people who will be infected with COVID-19. This number will be mostly low most of the time, but once in a while, we may see surge in the number of cases in the country before the numbers come down again. But what we're looking for is really, because most people in the population will already have been vaccinated, I talk about the number of infected cases will mean that even though we have a lot of COVID-19 cases in the population, we don't actually have many COVID-19 patients in the hospitals seeking care, because most of them will be vaccinated and they have mild symptoms at most. And this is when, as a country, we become confident we are able to allow our lives to return to near normal with very little restrictions on what we can or cannot do. And you talk about our travel, our ability to travel overseas, whether it is for work or for leisure. And because we have been vaccinated, that's the long-term game plan that Singapore, as well as many other countries, are aiming for when we talk about living with COVID-19. But presently, we are not there yet, because we still need more people in Singapore to come forward for their vaccination. And we need to constantly keep an eye on what is happening globally, whether new variants are emerging that will challenge our plans. But at the moment, I think it's suffice to say that the present scientific data shows very clearly that the vaccines that we are using in Singapore are very effective in protecting us against the severe effects of COVID-19 infection, even against the more transmissible Delta variant. And that's where I expect the new format to become useful, to continue showing that as vaccination number increases, the number of infected cases may increase, but this will have less impact on the number of people who require hospital care.
Professor, just to round up our discussion today, I just want to get your opinion on another matter. The Health Ministry said those who have taken the Sinovac vaccine are still required to undergo pre-event testing. What is the message that MOH is sending with this regulation?
So presently, Singapore has yet to approve Sinovac as one of the vaccines in the national vaccination rollout. And this is because the Health Sciences Authority, our HSA, is still waiting for additional data from Sinovac before they can conclude and make a firm decision. We know that the effectiveness of Sinovac from international reports is around 51%, compared to the figures of more than 90% for Pfizer and for Moderna. So while we await additional information and clarifications, asking people who have received the Sinovac vaccine to undergo pre-event testing is an additional layer of precaution, because these are large events that we anticipate people to come together to mingle. But I think it's important to also highlight that I anticipate this is just for the short term, that such testing will be required, because I do believe when we receive the clarification from Sinovac, or when the overall uptake of vaccination in Singapore reaches a sufficiently high level, we may actually change our entire policies on pre-event testing. And I think it's important to remember that on the whole, we want to ensure that people in Singapore are protected with the best available vaccines and the needed safety measures, while allowing our society to gradually resume our desired normalcy. And vaccinating with the most effective vaccines not only protect the individuals themselves, but also make the community safe as a whole to help protect each other in the country.
Thank you, Professor Teo, for your insights. That was Professor Teo Yik Ying, Dean of NUS's Swee Hock School of Public Health. Still on COVID-19 related news, Singapore has announced tighter measures for travellers from Australia in response to a spike in COVID-19 cases there. From Saturday, Singaporeans, PRs and long-term pass holders who have travelled to Australia in the past 21 days before their departure to Singapore will have to take a PCR test when they arrive here. They will then have to serve a 7-day stay-home notice at their residence and take another PCR test before the SHN period ends. Short-term travellers holding an air travel pass with similar travel history will be barred from entering Singapore. Meanwhile, those who enter Singapore from Guangdong, China will no longer have to serve SHN if their PCR test upon arrival is negative. Short-term visitors with travel history to Guangdong within the last 21 days before departing to Singapore can apply for the ATP with immediate effect for entry into the country on or after July 7th. Meanwhile, Singapore has inked a deal with drug maker GlaxoSmithKline for the supply of a medication to treat patients with mild to moderate COVID-19. Known as Sotrovimab, the drug is administered via intravenous infusion to treat patients who do not need supplemental oxygen but are at risk of developing severe disease. It's currently undergoing regulatory review by the Health Sciences Authority. Now, the drug has been approved for emergency use in the United States. In other local headlines, an investigation by the Corrupt Practices Investigation Bureau into corruption allegations made against a staff member of the Islamic Religious Council of Singapore found no evidence of wrongdoing. The MOH officer was alleged to have shown favoritism in recognizing foreign halal certification bodies. The findings follow separate internal investigations last year by MOH, which found allegations of abuse of power were unfounded. Despite the impact of the pandemic, Singapore's financial services sector grew by about 6% in the first half of this year and is expected to create more jobs as well. As for the property sector, the Monetary Authority of Singapore said it would remain vigilant over rising home prices, even though it said the market was not overheated. Strong housing market conditions have sparked speculation that the government may impose cooling measures for the first time since 2018. Great news for commuters who travel on the MRT. The second stage of the Thomson-East Coast MRT Line will start running from August 28th. The 6 stations slated to open are Springleaf, Lentor, Mayflower, Bright Hill, Upper Thomson and Caldecott. This stage of the project was delayed in part by the pandemic after the first stretch from Woodlands North to Woodlands South opened in January last year. Senior Transport Correspondent Christopher Tan is here with more. Welcome back to the show, Christopher. Tell us more about these 6 new Thomson-East Coast Line stations. What can commuters expect at these stations?
Okay, first of all, I think what we can expect from these stations on the Thomson-East Coast Line is that there will be a lot more entrances compared to the stations on older lines, which typically have 2, 3, or at most 4 entrances. At these new stations, you have up to 7 entrances. For instance, the Mayflower station has got 7 entrances linking to places like Ang Mo Kio Avenue 4, CHIJ St. Nicholas, Mayflower Primary and Secondary Schools, right? So the accessibility to the stations are fantastic, right? Lentor Station has got 5 entrances linking to places like the Lentor Estate and Teachers Estate. Same thing with Upper Thomson Station, 5 entrances linking to places like Shu Chao Estate, Housing Estate, Thomson Plaza, and Church of the Holy Spirit. So you can see that the effort to make our stations more accessible and more connected to the neighborhood that they are built in has come to fruition at last. And now commuters can expect better connectivity, not getting wet when it rains, and maybe a bit more shelter from the sun when they get out of the train and onto their destination.
And Christopher, Transport Minister S. Iswaran was at one of the stations this morning, the Caldecott station. He said this new line will enhance the resilience of the national rail network. Could you elaborate on this?
Yeah, so what he meant was that if, for instance, there should be a breakdown on one line, commuters actually now have an alternative, right? I mean, in the old days, we only have 2 lines, north-south and east-west. And if these 2 break down, I think, I think commuters will be at a loss. You'll have to either go for bus bridging or, find their own way around. But in the case of, for instance, when the Thomson-East Coast Line is fully open, you will see that the vertical line actually kind of mirrors the north-south line. So there's some alternative for them to, maybe they will have to, make their way a little bit longer than usual, but they have an alternative. And then the horizontal line that goes into the East Coast, it kind of mirrors the east-west line as well as the downtown line. So this is what he meant by resilience. So that in case there are technical glitches at one station or one line, people have an alternative they can turn to. Whereas in the past, when there's a breakdown, just, hard luck.
Well, thank you, Chris, for the sharing. I've been speaking with Christopher Tan, Senior Transport Correspondent at the Straits Times.
Thank you.
Now, before I go, this just in, Finance Minister Lawrence Wong will deliver a ministerial statement in Parliament next Monday, July 5th, on the government's support measures for businesses affected by tightened COVID-19 restrictions. He will also set out the funding approach for these measures in his statement at 3 p.m. that day. Now, you can follow the updates on straitstimes.com. Those are our top stories for today. Remember to subscribe to our YouTube channel by hitting the red button below. Once again, I'm Haryanto Diman. See you tomorrow for more stories on The Big Story.